Hi, my name is Annabel Kaplan and I'm a freshman dance major in the Honors College at Mason. I will be talking about research that I conducted last semester during Honors 110 on how tango dancing can improve functional mobility in Parkinson's disease patients. Let's start with some background information. Parkinson's disease is an uncurable progressive neurological disorder that seriously impacts a person's functional mobility, or ability to participate in day-to-day actions such as standing, sitting, walking, and turning around. Functional mobility can be clinically assessed in many ways, but my research focused on measures of the overall severity of the motor symptoms of Parkinson's disease, or motor severity, and assessments of balance and gait. There are numerous pharmacological treatments for Parkinson's disease, but none of them completely alleviate its symptoms. For this reason, Parkinson's disease patients are often prescribed some form of exercise therapy to preserve their functional mobility as their disease progresses. Recently, there has been an increasing amount of research on dance therapy as an alternative to traditional exercise therapy for Parkinson's disease, because the coordination of movement to music not only makes exercise more enjoyable, but could also provide additional benefits. The most well-researched form of dance therapy for Parkinson's disease is Argentine Tango. My research is centered around the question, what does research conducted over the past 15 years show about how participation in therapeutic Argentine Tango classes affects the functional mobility of Parkinson's disease patients in North America? Well, scholars generally agree that therapeutic Argentine Tango classes benefit the functional mobility of Parkinson's disease patients. They disagree on the extent of these benefits. These different perspectives most prominently come from a discrepancy in length of study. The different perspectives I researched are 2 to 3 week studies, 12 to 13 week studies, and 1 to 2 year studies. Both studies that I looked at that measured the benefits of a 2 to 3 week Tango program found significant improvement in participants' motor severity and balance, but neither found significant improvement in gait impairments. In the 12 to 13 week study perspective, both studies found significant improvement in participants' balance at the conclusion of the Argentine Tango program. In addition, one study found improvement in gait, while the other found improvement in motor severity. After studying a year-long Argentine Tango intervention program for Parkinson's disease patients, scholars Duncan and Earhart found improvement in motor severity, balance, and gait. They also found that participants maintained these improvements after a second year of Tango classes, even as their disease continued to progress. Well, scholars in all perspectives found that Argentine Tango had some benefits for the functional mobility of Parkinson's disease patients. Generally, the longer duration Argentine Tango programs found greater benefits than the shorter duration programs. This is why I feel that future research should focus on 1 year or longer studies and use more participants in their randomized controls trials to get more reliable data. Future research should also compare the benefits of therapeutic Argentine Tango classes to that of common pharmacological treatments. Common medications for the motor symptoms of Parkinson's disease can be expensive and often include harmful side effects. If similar benefits could be gained from an Argentine Tango program, it would save patients the additional cost. It is important to continue this research because if researchers can figure out how to maximize the benefit of an Argentine Tango program for the functional mobility of Parkinson's disease patients, it could significantly improve the quality of life for patients with this uncurable disease. Thank you for listening.